Okay, ladies and gentlemen, we are starting this session of the policy track. Good morning, everyone. My name is Björn Kümmel. I'm working for the Federal Ministry of Health, Germany. I'm the deputy head of the Global Health Division in our ministry. And I have the pleasure to, well, more or less, I'm not hosting, we are hosting the session. We have a great chair who will take over just in a second. But as the host, I will have some introductory remarks, primarily to tell you a little bit about the policy track. Some of you might have already participated in the ongoing policy tracks. The policy track is a new event of new format that at the World Health Summit that was initiated by the Federal Ministry of Health. We are financially contributing to making this World Health Summit work in the end. The objective of the policy track is to bring policy-related issues from Geneva, New York, or elsewhere to Berlin to discuss them here in this specific format, not only with policymakers, but primarily also involving you, civil society, foundations, private sector, and everybody. And then to more or less allow us, the German government, to, well, return and go back to Geneva, Washington, or elsewhere with this input coming from this session. So the idea is really to feed in debates from Geneva, but bringing it back to Geneva or elsewhere with this enriched Berlin perspective. The idea is also not to have upfront presentations like this one just now, but rather to have candid debates with you. So we're trying to limit PowerPoint presentations in the overall sessions, and we are looking forward to have a debate. Often what we've seen in the past are not too controversial debates, because in global health, often we're talking about the same things and we all are well, working together in quite a harmonized style. But that we don't want in this session or in the policy tracks. We rather want, well, a controversial style. So the idea was to have someone bringing in an argument in favor and the other one saying, no, this is bullshit. We want exactly the opposite. So let's have a fight on stage. That would be the wonderful idea. However, looking at the colleagues who we have assembled at the table, and I think I was also part of assembling this group, to me, at least, it feels a little bit like family reunion. So I fear we will not have too much of a fight, but let's hope for that and to have some kind of controversy. The policy track is also a format where we want your input. So please ask controversial questions or potentially say that some of the statements or presentations that you will hear don't make sense to you and ask for clarification. So what are we going to focus on today? I'm not going to say much because the chair will take this on board in a second. The session will focus on a new pandemic treaty, and that is one of the key themes that are currently being negotiated in Geneva by, well, the membership of WHO. It's highly controversial. It, I guess, was even more controversial a couple of months ago, and we will potentially see a growing consensus towards something like a pandemic treaty. We will see in the end. I'm sure that the moderator will explain us a little bit more about it just in a second. Obviously, Germany has a specific standpoint with regards to the pandemic treaty, and I'm also a German civil servant, so representing parts of the government. The Chancellor was among those who have supported and who is supporting the pandemic treaty. The idea came up by Charles Michel, and he has lobbied together with, I think, with a group, quite a broad group of heads of state and heads of governments through an op-ed that was circulated, I think, in March this year. Obviously, this will all is of highest relevance because policy makers, ministers, but also civil servants like myself will have the pleasure to be negotiating something at the end of November, start of December. There is a special session of the World Health Assembly looking at whether we need a pandemic treaty, what the benefits could be, or what the challenges are. And therefore, this policy track and the session of this policy track is of utmost importance. So it's my pleasure to give the floor to our moderator, Maike Voss. We are very glad to have you with us. Maike Voss is one of the leading German experts in global health governance. Obviously, she's been head of the Global Health Governance Research Team at the German Institute for International and Security Affairs, SWP in German, the abbreviation. However, now she is the project lead of a think tank development of the German Alliance of Climate Change and Health. I hope I got that all right. And it's an honor to pass the floor to you. Thank you. And we're looking forward to a great session.
Thank you very much. Thank you. So a warm welcome also from my side to the audience here in the room and also at home, because we have also digital audience here with us. And also, of course, welcome to you, to the panelists, and also to Jahud, who can't be with us here, but I see him and you see him here online as well. So we will be talking about a new pandemic treaty, as Björn just said. As a health and political scientist, I applaud the Ministry of Health to creating this policy track, because I think, my personal opinion, because we are asked to be critical, it was very much needed in the World Health Summit. So I hope to have a frank and controversial, insightful discussion. Just some quick questions to start off, to give you an idea where this conversation is leading to. In this year, in April, numerous heads of governments and international agencies came together to champion the establishment of a new international pandemic treaty. Supporters consider the treaty a crucial tool to make COVID-19 the pandemic to end all pandemics, very high expectations. However, these high expectations need to be double-checked and maybe even managed. So a couple of questions that we can discuss today is: what can be fulfilled at all by a new legal instrument? Is it really necessary? What would be the added benefit of a treaty to the existing international health regulations? How will the international community overcome practical issues such as the lack of accountability and funding for pandemic preparedness? So these are just some questions we like to answer. Just a quick overview, very quick, of the agenda today. I will introduce the panelists in just a second. Then I will kick off with a round of questions, and then leading into discussion with the audience here in the room. Please feel free to raise your hands if you like, or you can use also the Slido tool that will be, I think, explained in a slide, or I can explain it as well. It's an online tool that you can use to put in your questions and comments that I can then pick up with the iPad here. In the end, there will also be a quick evaluation we ask you to make, and Mr. Kümmel will close the session in the end. So I think that was my words on housekeeping. Don't worry, it sounds more complicated with Slido than it is in the end. You can also here in the room ask your questions directly. So the panelists. I tried to learn your name, Simona. I hope you forgive me when I don't pronounce it correctly. So Simona Gueva, almost, is a lawyer by training and foreign policy advisor to the president of the European Council, Charles Michel. Dr. Jahud Mayur, Assistant Director General for Emergency Preparedness and the International Health Regulations at the World Health Summit, World Health Organization, which can't be with us, but you see him here. Dr. Anders Nordström, Swedish Ambassador for Global Health at the Ministry for Foreign Affairs and Head Secretariat of the IPPPR. You will talk about and maybe tell us a little bit more about that. And Professor Gianluca Burgi, Adjunct Professor of International Law at the Graduate Institute of International and Development Study and Director of the joint LLM, Global Health Law and Governance, between the Graduate Institute and Georgetown Law School. Okay.
A mouthful, yeah.
It is. So let's just start with our discussion. Simona, first question for you. Why did Charles Michel advocate for an international pandemic treaty?
Thanks, Mike. Thank you all. And maybe before I start, I should say I'm quite flattered that Bjorn said welcome to the family, because I'm actually a crisis manager. So I have no background in health. So if there was no crisis, I wouldn't be here with you. And I think also if there was no crisis, President Charles Michel wouldn't have advocated for a pandemic treaty. He proposed this idea last year about this time in November at the Paris Peace Forum, because after 6 months of pandemic, we saw that there was very little push or political will for a multilateral response to this crisis. And in his very personal conviction, which I share strongly, this is the only way you can handle such a global challenge. And not only that, to take it further, this is of the responsibility of heads of state and government at the highest level. This is not the responsibility for a health ministry here or for a health organization there or for an agency, God knows where. So he very strongly feels, and we have been working exactly towards that end, to have this led at the level of heads of state of government, to set very clear rules, very clear expectations on how to manage a crisis, but also how to prevent future ones. I mean, I don't know if this will be the last of all pandemics, but I certainly hope if we have another one, we will be much better prepared. I don't think our citizens will forgive us if we're not, and I don't think we'll have any credibility. Now, to go against what you've all said of no presentations and stuff, I have abused the niceness of our hosts to show you one or two things, which I think just to illustrate what we're talking about. If we can put them on, please. So this panel is entitled The Bretton Woods Moment. And as some of you might have done the same as me, what was Bretton Woods again? I know it ended in the 70s, but Bretton Woods is the financial system that was set up after the Second World War. The idea was to have, let's say, common system of our currencies after everything was inflated and nothing worked. Now, this is from the World Bank. You see that we are apparently in a Bretton Woods moment. We are in the biggest recession since the Second World War, and due to a health crisis, not a financial crisis. We are more than double of the recession that was due to the financial crisis in 2009. But it gets worse. I don't know if I can change to the next. Could you put the next one? I'm not managing. In the financial crisis, nobody died, at least as far as I know. Here we've got some extra bad situation. I would have given you the figures from the Second World War, but they're very, very controversial. So in order not to offend anyone, we're on the First World War, where we had 20 million deaths over 4 years or a bit more. Now we're at almost 5 million deaths in not even 2 years. So this is a ratio which is very, very concerning. And then you take the wounded, there are 21 million wounded. We don't really talk about wounded in a health crisis, but we have just diagnosed what long COVID is. We don't know how long it will take. We don't know what impact it would have. And when you look at the cases that we have, 243 million cases worldwide today, it is very, very scary to us what this can become. So I will not show you the rest of the slides. I have another two, but I just wanted to illustrate why I think Bretton Woods is the best name you could have had for this panel. And I think there is no better time than to take real action at the highest possible level, and there is no time for it. So that's from me. Thanks, Mike.
Thank you very much, Simona. Jode, I hope you can hear us. I have a question for you. How would the pandemic response look like if we had a treaty like we are discussing right now already? What, and if any, would be the difference from the status quo now? And what would how would countries act differently with a pandemic treaty? What are your expectations?
Yeah, thank you. Thank you very much. And very happy to be with you today, and especially with good friends who are expert in this area of work. I think if the world had a global framework to prepare and respond for pandemic, the world will be better than this one, because many things that happen today are due to the lack of preparedness at the country level, but also at the global level. Many countries with the mature health system thought that they are prepared to deal with any kind of threat. But this pandemic, because of its scale and because of the magnitude of the impact, shows that no single health system was prepared for this kind of pandemic, and every country, including those with mature health system, need to look at their preparedness and to look at the global level. We missed an opportunity to come up together with the global coordination mechanism that can very helpful, and we saw it. We saw it in the beginning of the pandemic. The world doesn't have effective supply chain and logistics to bring goods where they're needed. We had some big problems in dealing with equity issues, and many countries doesn't access to basic countermeasures and goods. In the beginning, it was with the PPE. After that, it was about diagnostic, and now we are also facing a big problem of equity to have access to the vaccine. I think during the COVID-19 pandemic, many panels, including the IPPR, who are with us today, and others, issued several recommendations to improve pandemic preparedness response. And we looked to this recommendation, all of them, and we found that at least 20%, 1/5 of this recommendation, to be optimally or effectively implemented, they need a new instrument or new framework that bring countries together in more solidarity to respond to the challenges and to prepare for the next pandemic. These are the area who cannot be implemented through existing mechanism now and need this new momentum are areas like governance, leadership, and political commitment, areas like One Health, which became extremely important in terms of preparedness and responding to the future pandemic, the sustainable and predictable financing for pandemic preparedness response at the country level, but also at the global level. And we cannot move with country preparedness unless that we mobilize resources at the global level to support countries who need to be supported. We still have big issues about timely sharing of biological material and benefit. Also I say the equity, which is extremely important, and also the transfer of know-how and technology to countries to produce countermeasures, including vaccine to respond to. And more importantly, and this is the area that we need collectively to look at, how to empower individuals, communities, and civil societies, and to be part of the preparedness and response, not only executing recommendations from different sources. To the short answer to your question, if we had a similar framework, I'm sure that the response to the pandemic could have been much better, much stronger, and anchored in very large solidarity among countries, more countries. Back to you. Thank you.
Thank you very much. I think that's the big hope, but let me ask you maybe again, what would be the difference from the status quo in a world where we have the international health regulations?
I think the international health regulation, they have defined scope, and the scope of the international health regulation is first to ask countries to have core capacities to detect and respond to outbreaks. Second, to share information. Third, to prevent travel spread of disease. And when the IHR was discussed and designed, and Gianluca was part of this process, was designed to look to mid or small outbreak like the SARS that we saw, but definitely the IHR doesn't cover many areas that are needed in large-scale pandemic like this one. And this is what I tried to mention in the beginning. But yet, the member state working group who are now discussing the future of pandemic preparedness response, they agreed collectively that is not either or. And they agreed that any future pandemic preparedness response should be based on first strengthening the implementation of IHR, including better compliance and some targeted amendment. Second, to strengthen the existing framework and not to duplicate and create new one to avoid fragmentation, and discussing the treaty or instrument to cover areas who cannot be covered under the existing mechanism.
Okay, thank you very much. I'm sorry, I forgot in the beginning to tell you that we have prepared a poll. You find it also online on Slido with 2 questions. One is open now, which is, would a pandemic treaty bring added value to a pandemic preparedness and response? So we would like to, Gasper, what you think here in the room to then bring also to the podium. So if you want to answer, we can then use what you think answering these 2 questions. Gianluca, yesterday you said to me that you are quite happy that we put a question mark in the end of the title, the Bretton Woods moment for global health. I would like you to share this with you, and also the question if a new pandemic treaty would overcome shortcomings and gaps in the international system and in the international health regulations.
Yeah, thank you, Mac. And first of all, I'm very happy to be here, very flattered to have been invited. The World Health Summit is one of those events like the Prince Mahidol in Bangkok, where if you're anybody in global health, you must go once in your life. For international lawyers, like going to the International Court of Justice in The Hague. I haven't yet managed that, but at least I'm here in Berlin. So why did I say that? Because I don't think that, first, 2 reasons. The first is that we're talking about the Bretton Woods moment. People are talking about the San Francisco moment, like 1945 after the war, creating the UN, existential crisis, once in a lifetime, once in a century. So there's an abundance of rhetoric. But until now, I must say that what we're seeing in political terms, it's a bit shorter of that level of ambition. So I agree with Simona, we need that kind of bold thinking. Why was I happy with the question mark? Because I don't think that a treaty in isolation can be a Bretton Woods moment. A Bretton Woods moment requires many interventions of which a treaty can be a part. It definitely requires strengthening WHO and the IHR, and I'm very encouraged, like Jawad reminded us, that the momentum seems to be in not dismissing the IHR, but investing in them alongside a treaty that will fill other gaps. But there's also need for other things to fix other international regimes. Think of environment, human rights, trade, they've all suffered. This goes way beyond health. So you have to think in terms, Bretton Woods terms means to think beyond health. And so it requires many, I think, many interventions within the health field and beyond the health field. So I think Jawad, I agree with him in what he said. The gaps are there, both in what has led to the pandemic and in terms of what the pandemic has created in terms of effect, implications, consequences, and so on. The IHR were not created to address the whole spectrum of preparedness and response and so on. They have a limited scope, which is preparedness, detection, and containment, as Jawad reminded us. And I think it's good if they remain within this core. Without thinking of exploding them into many other directions. So there are gaps upstream and downstream that need to be fixed. They require, in my view, a legal tool, a legal instrument, and a treaty could be that instrument. But there are many ways to address the same problems. For example, we're talking about pathogen and benefit sharing, like Jawad mentioned. Those are also falling under different legal regimes that could be strengthened and revised to address that. So there is not just one way to a goal. There can be different direction. But I think a pandemic treaty with a sort of sound consensus and boldness, but also realism, could be part of that gut feeling, if you want.
Okay, what do you think how realistic is that we have a pandemic treaty in the sense you just mentioned in the end?
But I think the train has left the station. There is a lot of momentum, and it's difficult now to stop the train. And I don't see why the train should be stopped. I think, as I think Bjorn said at the beginning, managing expectation, that's very important, because sometimes the maybe that's part of the political momentum, but there are over expectations, like a treaty that would be the salvation of mankind and will cover everything. It's not possible. So I think you need to pick up quite carefully the topics that can be adequately regulated through a treaty and not through different instruments, where there is enough consensus, when there is a gap to fill, and where a binding instrument can make a difference down the line, and without over expectations, but looking realistically to feasibility, to needs, and also to political dimensions. I mean, it's not a good moment for multilateralism. So also the level of ambition has to be there, but it's to be tempered with realism. So I would agree with Jawad when you mention One Health, for example. That's clearly a blind spot in international law. We do need something to decrease the risk of zoonotic spillover. And that to me is, if I can pick up one intervention very much on the prevention side, it would be that.
Thank you. Anders, the IPPPR also recommended a pandemic treaty. Maybe you can explore a little bit why and what you think would be the added value to global health security in general.
Well, thank you very much. First, I would love to talk more about what Gianluca spoke about, the political situation right now, when I'm deeply worried about what we see right now across the world, but possibly we can come back to that. So to say just a couple of words about the panel was co-chaired then by President Sirleaf and Helen Clark, as I think all of you know, and Michelle Kashachkin, sitting in the audience here, was one of the panelists. The panel did basically two things. One was to make an analysis, what can we learn this far, and then make recommendations. And one of the recommendations was, yes, that a pandemic convention would be a useful additional tool. But also, as Gianluca is saying, possibly not the only silver bullet, but one tool in a broader package of reforms. In terms of the analysis and why the panel actually came to this conclusion, the panel did a very detailed analysis of what happened during the first 4 months, the so-called chronology. And we learned a lot from that. It's been published, the facts online. It's coming now in a Lancet publication just in a couple of weeks, I think, with more of an analysis in terms of what conclusions could we draw from this. Second, the panel did also 28 country studies to understand what the response was in countries. And also one of the 16 background papers that the panel did was on the topic of IHR and a potential convention, looking into the shortcomings of IHR, the potential of a convention, but also making references to the climate architecture, the climate convention, and an inventory of, I think, 20 other conventions. What can we learn from this? And I think the big picture, the big message is that the present international structures or regulations, the IHR that we have in place right now are not good, are not well enough, are not good enough. They are too limited. And I think, Joe, you were a bit too diplomatic, saying that they have limitations. I think basically they have two functions. One is to make sure that countries report and that WHO sends an alarm. And I'll come to why we found that even that didn't work. And the second one is to limit the impact on travel and trade. And that's it. So it's a very limited sort of international tool here. And that is why I think the panel then concluded that there is need for something that is actually dealing with the complex issues around how do you deal with the pandemic, both the preparedness, the alarm, and the response. So 4 key findings from the panel that also influenced this. The first one was, as you heard this many times, and you know this, the world was not prepared. But even worse, that the instruments that we had to project whether the world was prepared. We had the global health security indexes, but also linked to the IHR, the joint external evaluation, and the way of how we assess countries' capabilities, capacities, didn't work. So countries that ranked high didn't do very well. So that part of IHR to project whether we were prepared or not good enough. Second one, and this is really the focus of what we did in terms of our chronology, there were some delays at the beginning. A couple of days delay, or sort of, it took a bit of time early for both the Chinese authority and WHO actually to share and inform the world about this new virus. Not many days, not much perhaps, but still. Simultaneously, the virus had spread, information had spread over social media quicker than how the IHR focal points and formal system actually were able to report. Next delay was how the international health regulations stipulated expert review committee was called on the 21st of January, no conclusions. Next then meeting again, 30th of January. Then the Director General then says this is a public health emergency of international concern. That was more than 1 month after the actual outbreak started in China. So again, a delay. But the big delay, as the panel found, was that no one reacted. So the way that the IHR is actually sending the alarm, a fake, people thought it was a fake, not reality. So it was not until the Director General is actually using the word pandemic on the 11th of March and the hospitals are beginning to fill up in Italy that the world wakes up. So there were delays, and the system, that's a conclusion also, that the systems to the alarm, the information, and also then the authority of what WHO can do or not is not good enough. The third part was really how countries responded. There's no way that the world was basically not prepared to be able to get organized to respond. Who is responsible for what? How do we do? What do we do? And IHR do not say absolutely anything about this. So that's the third reason. And the fourth reason, as I hinted on, was the international system at large. WHO's authority then to immediately publish without going to Article 10, paragraph D in the IHR, where you are actually allowed to publish without the authority of the concerned government. You can do that, but only when you've done A, B, and C. It's not good enough. And the same thing for WHO not having the possibility actually to go to Germany when you have an outbreak of a disease here in Munich within 7 days and be able to confirm whether Germany has a problem and the world has a problem or not. That does not exist. So that WHO is not empowered with the right kind of authority to be able to make the world more safe. I'll finish just to say that what the panel also was very clear about was that it's not only about WHO. The international system at large is not well enough organized. So we need a strong WHO with specific functions like the ones I was referring to, but you need also an international system at large. So the other components, and again, a convention is not only the only instrument, the only part of a reform agenda, but you need better governance at the highest possible level. You need more and substantially higher financing, and you will never be able to attach that to convention only. You need other kind of money here. You need a future Act A, a platform to be able to have access to vaccines. Question mark what that should look like. Possibly a convention can set rules for that, but not do it. So just to say that the panel, and I'm seeing at least Michelle is nodding a bit, found that there was a number of issues here that we found, and that the convention can actually be helpful addressing some of those, but it's not going to be the only reform that is needed if we're going to have a more safe world for the future.
Okay, thank you. Thank you very much. Gianluca, I know I prepared another question for you, but I think we can tap into the political situation, geopolitics of the pandemic treaty, and maybe you want to reflect a little bit on what Anders just has started as a new space for conversation.
Well, on the politics, obviously that's a big question, but I agree with Anders. It's not the best possible moment for multilateralism. You can see it also in the discussions on WHO and how immediately some countries get obsessed on process and so on, which is a typical way to stall things when they politically they are not in favor. But again, let's go back to the Bretton Woods metaphor, or to San Francisco and so on. The end of the Second World War, obviously there was an hegemonic country like the US, but you had Cold War starting, and still countries got together and for better or worse created the United Nations system, the financial institutions and so on. So also geopolitical differences are not the end of the story. When there is a perceived need, a perceived common need, which was clear in 1945, and I hope it's clear today, that as the title of the IPPI report, make it the last pandemic, because another one like this, and frankly, it's catastrophic just to think about it. So there should be almost intuitively a shared need, but also shared vulnerability that should orient things and in a way, to a certain extent, overcome at least part of the political differences. And the other point is political differences have to be channeled through a process. That's what multilateral diplomacy is about. And in that, I agree, I think also with implicitly what Simona was aiming at, that you need that kind of boldness to jump into the process without ask questions, but then stop asking questions. Start the process where questions can be answered together, not in like a tit for tat kind of debate, which is what you sort of witnessing now to a certain extent, and check the level of consensus when you start discussing specific issues, not generalities. So again, it's not a particularly good moment, but it shouldn't be the end of the story. And to me, a credible, legitimate, inclusive process can reduce and narrow the areas of difference. And created a basis, at least to agree on the fundamentals, how to move forward. And the other point is time. Obviously, you need to keep the momentum. If there is a treaty would be negotiated, it should have been negotiated for 10 years. But also, when the APPR said we need a treaty in 6 months, where was it coming from? I mean, you barely have the resolution of the Health Assembly in 6 months. So time is important. And because a treaty is not a universal law, it's a contract that countries have to sign and ratify. And so also the time to have a good consensual package is important for the future.
So I saw Anders.
No, just a very quick answer to that. That was after the Chernobyl accident. That took 6 months to have an international agreement to share information about whether you have a nuclear accident. That took 6 months. That was where we were coming from.
Fine, but you cannot automatically transpose this kind of situation.
No, I'm just saying that this is also an enormous emergency, a shock, crisis for the world. So why is the world not acting? It could act within 6 months if the political will were there. And I'm deeply concerned that we not have that right now.
Simona.
If I may, I entirely agree with Anders. I'm not sure I agree about the 6 months, but I'm hoping a year max. I know Gianluca will think I'm crazy. But actually, I really don't think we have the time. I also think if we get bogged down in a 10-year process, I'm not sure what it will help us. But also because we're in this geopolitical discussion, I just want to bring us a little bit into, let's say, a reality check. Yes, it's a bad place for multilateralism and bad time, but would you like to leave it like this?
No.
The only thing that the big countries could possibly agree on right now, and big countries, I'm talking US, China, and Russia, is health. These are the only thing they actually want to work together on. So this geopolitical argument is actually in favor of us doing this, it's not against it. So this is, for me, a little bit of a strange context. Also, in terms of, I mean, I agree with everything that has been said, and we can argue endlessly what's in the IHR, what's not in the IHR. For those of you with European background here, you can imagine how strange this is for me. It's like arguing the merits of the Lisbon Treaty or the Maastricht Treaty against some technical regulation. It is a completely different issue. The IHR are technical regulations and they're excellent and the experts have worked years and years on them, but not a single head of state or government has ever seen this thing. Not a single parliament has approved it. Not a single economics or research institute in the countries has seen it. So you don't have a level of responsibility, which I think is what Anders mentioned. You don't have a level of accountability in the rest of your government sector and in the rest of your society. Nobody knows what this IHR is, what it's supposed to do. So for me, the treaty process is extremely important. And thanks, Gianluca, for saying it, that we just have to jump in it, because when you jump in it, you bring all of the society and all of the government. This is where you get the buy-in, the actual knowledge that you need, because it's your economics ministry that will finance your vaccine research. It's not the health ministries. It's not all of you, and I say you because, like I said, I'm not really a health expert, people who agree among you, who have been calling for 20 years for someone to pay attention to the health risks. It's the other sectors that we need to wake up. And then you wonder, whether the political will go, whether, people will do what they have pledged. Well, it has not gone through their parliaments. So in the next crisis, the national parliament, you say, no, you take care of our citizens first. You don't care of the others. If you have a treaty, if you have some sort of ground rules, then the administration and the leaders have a mandate of what to do, why they're helping others, not just out of some moral objective where you're entirely dependent on the leader at the time who is elected, but out of common rules. And, you know, we had the reference to climate. You have the COP26 now, number 26 Conference of Parties at heads of state and government. And we're all about it. Everybody's talking about it. You turn on the news, it's COP26. Okay, it's the health of our planet is extremely important, but isn't the health of us first very important or equally? Because I hope we can come back to the One Health. I mean, this is a really important thing. And I do hope the treaty will be able to help, though here I'm going also with the careful of expectations, but I do hope the treaty will make a difference.
Thank you, Simona. We have the first poll results of what we are missing, maybe a little bit also in the discussion. We can see it. In your opinion, would epidemic treaty bring added value? We have a big yes. So let's discuss further how to maybe make it possible. I would like to talk about also on the content side, but maybe give the word back to, okay, sorry, there was a lot more than that.
These are answers, or?
These are answers, yeah. Accountability, I read here, enhanced compliance of the IHR. Also, society approach, yeah, that what we talked about just now. Okay, I read also big expectations here.
Yeah.
Big expectations. Yeah, that's good questions. I would say we keep this and maybe also send these answers to you as the chair. So maybe that's food for thought for also after the event. Because maybe that's
Thank you for my homework.
Maybe a bit too long to read through all of this now, but thank you to the audience and at home for sending these. We will of course consider it. I would like to go back to Jahoud and ask the question, what is the plan of WHO to bring in other sectors? As Simona just said, how do we go, or how do we get to an all society approach?
Yeah, thank you very much. This is extremely important, and the member states are now discussing on how to move with the idea of the international agreement. And definitely from their side, they are already consulting with some key stakeholders at the international level. And definitely WHO constitution allow WHO to adopt treaties who bring multi-sectors together, because very often we believe, or we say that WHO is ministers of health organization. Just to remind ourselves that our constitution is about member state. We are a member state organization, which the whole countries and states are part of this organization. And WHO can take a global instrument, bring in head of state and other components. And one of the example is the tobacco framework, where some provision of the convention go beyond the ministries of health, and this is our constitution allow this kind of work. Second, I think if international treaty or framework or agreement is adopted, it definitely will aim two issues. First, solidarity. Second, sharing information, sharing data, sharing technology, sharing goods, and sharing issues. And we cannot operate in this field and on the One Health, for example, field without bringing stakeholders together at the international level, but also at the national level. And one of the strengths of the international treaty is the ratification process. We strongly believe that during the ratification process at the country level, all the part of the society and the government will be involved, will discuss, will give their views. And this is extremely important to implement the whole of society and the whole of government that all of us will speak about. is during the ratification process at the country level. The same dynamic should be established at the global level. The answer to the question, yes, capacity. WHO has the capacity to bring key stakeholders together, and WHO will do it to bring all stakeholders, including the civil society and other organizations, on board while discussing the content of the treaty. I strongly believe that this is an opportunity for us to come up with something very strong to prepare for the next pandemic, because all experts agreed that we will have pandemic. The matter is not if, but when, and we need to be prepared for it if we want to respond to it properly.
Thank you very much. I just reflected on when we talk about WHO and an all society approach, then about WHO's weak position and weak authority, what Anders just said. Simona, considering the situation in the world where high income countries hoard basically all the vaccines, what do you think can a pandemic treaty change, and would high income countries allow a change?
Well, I have to put a disclaimer here. The EU has not hoarded any vaccines. But no, there is an inequity and there is a disparity. And actually, in this call on the pandemic treaty, which came from 26 heads of state and government from every continent in the world, one of the main calls was for this treaty to have equity and to ensure vaccine access to all. So that is what these heads of state of government have asked for, what the entire European Council has supported. So at least on our side, we are very much committed to this. So clearly we're already investing in building manufacturing capacity in Africa, because I think one of the ways to get out of this is indeed to have more manufacturing capacity, to not be entirely dependable. But in practical terms, as things stand, the cynical answer to your question is nobody has to do anything. There are no rules about this. None of these countries are obligated, I mean, we get all these nice moral, oh, why didn't this country give? Oh, they've given a pledge. They're not fast enough. Fast enough for whom? They have no legal obligations to do this. So for me, I think it's very important that we have some ground rules. Yes, but we have to manage expectations, and we will not be saving the world just with one treaty. But if you have ground rules, if you know what to expect, let's say a pandemic comes, you pull the alarm. If you're the country that pulls the alarm at the moment with this IHR, which is very basic, you're not sure how much help you're going to get, if you're going to get any help, but you are sure that everybody will close down your borders. You will get nothing from anyone. So if you are, let's say, a small tourist-based country, the disadvantages to pulling the alarm and notifying are much, much worse than the advantages. So I think we have to have some basic ground rules where, you are obligated to pull the alarm, but the others are obligated to help you, no matter if they're rich or they're poor, because we don't know where the vaccines will be. We don't know where the knowledge will be. I mean, these vaccines were invented now in Germany and US. We don't know where the next ones will be invented either, nor do we know where the next pandemic will start. So we need ground rules, irrespective of what happens, who is rich, who is poor, and who is the head of government at that time. That would be my answer.
Thank you. I think that leads us to the content. What should we expect or think of writing into it? Anders, maybe you can reflect on what are the ground rules?
Thank you. I think exactly a convention or treaty should be about the rules. And let me also say what it should not be about. And I think basically, as I hinted before, a convention would be extremely useful sort of from the end to end. What is needed in terms of preparedness, what is needed in terms of information sharing and the alarm, and what is needed in terms of the response, the whole from the beginning to the end if something would happen again. That's basically where a convention, a framework convention would be very useful. But set the rules in terms of who needs to do what are rights and obligations in this, I think it would be interesting also, it would be important to think about national level and regional level, because a lot is happening now within the European Union in terms of now getting organized. But how is that also going to connect to the global level? I'm not sure. So I think that is something that needs to be thought of so that we get a comprehensive international system. For me, it's quite simple, but let me also say what it should not be. Please. Because I think there are issues that a treaty will not be able to deal with. First one is WHO itself. There's a need for reforms of WHO. And I think WHO needs to be sharper, more focused, increase quality of the work. And the critical issue then when it comes to WHO is reforming the financing. The treaty will not solve that issue. Just to be clear, WHO needs substantive reforms in terms of focusing the work, but also increasing the quality, and the answer to that is basically reforming the financing. The second one is then also, if we talk about money, that is to mobilize big money. In some way, big for us today, 10, 15 billion US dollars per year. But if you look at what this pandemic has cost us this far, it's extremely small money. That kind of money to invest in preparedness, but also to be possible to be available if something happened again, that a treaty can't deal with. We need to find a different financial modality to deal with that. That was one of the recommendations of the panel. The panel also said very clearly that we need political leadership that goes beyond health, that goes beyond WHO at the highest level, taking a multisectoral approach. The panel recommending then to establish a Global Health Threats Council by the United Nations General Assembly at a heads of state level. That is, again, that kind of political leadership looking across the whole systems beyond the rules. A political body, again, a treaty can't deal with that. And the final one is then what we are writing to now is about the redistribution of vaccines. A convention, a treaty could potentially set some of the rules here for better equity and a better sort of way of working. But the fact of doing the work, quote unquote, which basically COVAX, Act A, Gavi is doing today, a convention could of course not do. So you still need to think through what should actually the operational aspects of the system look like for the future. And the panel recommended more of a thorough evaluation to see what we can learn from Act A, what kind of end-to-end platform do we need for the future? And that, I think, is still to be concluded on. So message that a convention that covers both the preparedness, the alarm system, and the response rules of the game, but then there's a number of other aspects. So a reform agenda that goes beyond the convention, I think is extremely important. And my final word is, as I said, I'm quite concerned about the political situation right now. This is not, I was saying this yesterday in another debate, this is not rocket science. Just do it. I mean, reform the financing of WHO, take a decision on the convention, establish a new financing modality, establish a Global Health Threats Council, make sure that we have a different Act A for the future. It's simple. It's simple compared to what we spoke about the climate agenda. That's difficult. That's big. This is in some way technical, simple health matters. That shouldn't be rocket science for politicians just to agree on. But that is not what we're seeing right now. Contrary.
Okay, thank you. Jawood, is it that easy? I see your hand up, and maybe you can also reflect on the ground rules. And also you said sharing. How can we make countries share pathogens, share information in an equitable way?
No, yeah, thank you very much. I will come to this question, but I want just to speak about how the treaty can make the role of WHO central to the pandemic preparedness response. I think high-level commitment from head of state positioning WHO as the leading agency on public health matters, including pandemic preparedness. Yes, it will strengthen WHO, and of course there is other fora where some element of strengthening WHO is ongoing, like the sustainable financing of WHO that led by Bjorn, and this will aim to look to the financing of preparedness of WHO. But again, we very often say that bigger leadership, it's mean outside of WHO. WHO constitution allow WHO to bring head of state together, allow WHO to come up with any kind of coordination mechanism among head of states at very high level political level. I think this is something extremely important to keep in mind. And the only thing that we need to avoid during this, how to say, this negotiation about the future of pandemic preparedness is to avoid fragmentation. Let us work together under WHO umbrella, because its constitution, what it was built in 1948, allowed this kind of things to happen, and everything to reform pandemic preparedness and response could be done under the WHO constitution. And the new instrument or new treaty, from the analysis of the old recommendations that were made, including the IPPR, the IOEC, and other mechanisms, a new treaty need to cover 4 or 5 or 6 areas. The first one is to put the national preparedness and response to epidemics and outbreak at the center of any global preparedness. The world will not be prepared unless that all countries are prepared, and no country will be prepared unless all communities and all localities are prepared. This is a paradigm that we need to put at the center of our thinking. The same element that could be in a treaty is we need to have global tools and systems to prepare and to respond for a pandemic. Today, we don't have a logistic and supply global system. Today, we don't have clear mechanism to activate research and development to prepare for pandemic. The same for sharing pathogen and other issues. The third element that is important to be under any international instrument is equity. Equitable access to countermeasures is the key, not at the end of the pandemic, but at the beginning of the pandemic. We need to insist on the timely importance of the timely sharing of countermeasures. The third one is, the fourth one is, we need to have sustainable and predictable financing for pandemic preparedness and response at the country level from domestic resources, but also at the global level to support countries who cannot mobilize the resources for this issue, and also to finance the global goods and mechanisms that need to be in place. And at the center of it, a treaty should come up with strong governance and oversight mechanisms under WHO leadership, as I said, beginning. I think these are the ingredients of any international treaty, at least from what we heard and we read in the recommendation that came from on the panel and from our technical analysis. Thank you.
Thank you very much. Maybe Gianluca and then Simona, and then we open up a little bit more on the ground rules, content or ingredients, as we just heard.
Yes, thank you. So I go back to what I was saying before. In my view, first of all, I don't agree with this dismissal of the IHR as this sort of a quaint technical thing that only ministries of health know about. The COVID-19 has put the IHR on the desk of prime ministers, and I don't see why it shouldn't remain the sandbox of ministries of health. Because it's a treaty can complement, in my view, but cannot replace the IHR and should not duplicate the IHR. That only creates confusion, creates potential conflict, and so on. So there is a space for different instruments. And part of the ground rules, in my view, require strengthening the IHR, investing in WHO, the question of financing, but also political backing. One of the criticisms from the IPPR was precisely that WHO took a long time because of this, if you want, classical diplomatic attitude. Until China gave the green light, WHO did not sort of raise the level of alert. And I think one of the most constructive proposals from your panel was to give WHO the power to give alert on the basis of reliable but unverified information. I think that will make quite a difference to speed up the level of alert. And I don't see this as the ground rules in a treaty, because that's clearly a global function. It's not something that can be shared among 60 parties or 65. It's something that has to be seen as a global public good that has to stay and remain within a global instruments like the IHR in a strengthened and more politically empowered and financially empowered WHO. When it comes to the content, I agree with many of the things that the other panelists have said, but I think it should really look upstream and downstream and fill gaps. I go again to the One Health and the prevention of pandemic spillover, because look at from HIV on, most of the bad diseases have all been of animal origin. So we do clearly have a problem. And there's a blind spot, as I said, in international law on this point. The second is pathogen and benefit sharing. The conversation has been dominated by the impact of the Biodiversity Convention, the Nagoya Protocol, with all the problems that it's generating. So to me, a treaty would be a golden opportunity to carve out a regime that responds to the needs of public health, while keeping the principles of equity and balance that are enshrined in the biodiversity regime. They're clearly politically very important for developing countries. The third is the question of travel and trade. We see the mess that we've been in the last 20 months, even within the European context, where coordination should be easier. And the fourth is countermeasures. But countermeasures is a world of its own. It goes from sharing a pathogen to research and development, to clinical trials, to regulatory approval, to manufacturing, to allocation. It's really a world of its own. And so obviously not everything can go into the treaty. So I think it's important to discuss what can be the ground rules that can be regulated in a treaty that give also assurance to many low and middle income countries that clearly say, until and unless we get a clear sense of commitment from developed countries about the seriousness of equity, it's difficult to engage in the rest. So they clearly will use it as a bargaining chip in negotiating a treaty. So the seriousness of these ground rules would be, to me, decisive in whether or not we're going to have a treaty. But clearly the whole innovation cycle cannot be regulated by a treaty. And also it has to be fixed at peacetime. Like Jawad said, you need something that can be triggered when we have a pandemic. But if you wait until you have a pandemic to pull the trigger, you've seen what happened now. So really that requires a more sort of revolutionary approach that changes some of the ground rules at peacetime in the pharmaceutical market, not just waiting for the next pandemic.
Maybe one, maybe naive or cynical questions. We started in April to talk about this whole process, and we still not have any kind of consensus on the content. What is the treaty really addressing? Isn't that a bit, maybe for all of you?
We never said we will have consensus on it. That was never the aim. If you want to have a real discussion like the one we're having now, you're never going to, in the whole of society and the whole of government approach, why would you prejudice them in advance? So I wouldn't worry about it. This was never our aim. We want to start intergovernmental negotiations, and we need the mandates from our parliaments and our ministries, which is exactly the point. None of this is happening right now, and this is why we want to make it happen. But that you should have a consensus on the content in advance. If I may come to something Anders was saying, that it's all very simple. It's not simple. If it was simple, it would have been done before. I think, if I may paraphrase, what Anders meant is it should be self-evident. It should be self-evident that we should get on with it. And somehow it's not. And when we say the climate is difficult, well, yes, but this is going to cost as much as the climate. Huh? This is going to cost as much or more. So this is just as complicated. Moreover, I think, you know, so much science has shown that they're interlinked. What we do with our deforestation, what we do with wild animals directly affects our health. So how can we deal with one, with the climate at the COP? But then, you know, with this, we have our IHR, which I'm sorry, I respect very much. I didn't mean to offend the IHR, but they just have a very limited scope. They were never meant for this. We cannot put these expectations on this IHR. So yes, for me, I would say I wouldn't bind the content. I would like to have it as broad as possible, at least to have the discussion as broad as possible. Then we see what happens. For what there is political will, like Gianluca said, once the negotiations start, then you see where you can find consensus and who can compromise with what. But we shouldn't be binding ourselves in advance on this.
And as I see some nodding and some agreeing.
Yeah, I think a different panel, we should discuss the co-benefits in between health and climate, because I think they are huge. But the question to Jean-Luc, because when we did our work, we were looking at the climate convention and the construction, that's a framework convention, and you have different protocols attached. Can we have the same thing here? So you don't sort of negotiate the details, but you have a framework convention and you have different protocols attached and associated to this. And that IHR could be one point of reference to this. Is that I'm a doctor, I'm not a lawyer, so I'm asking you as a legal expert.
I remember you saying a couple of months ago, maybe we can come up with a manual. Maybe that's, I think.
Did I?
I think you said that. So what
I can
kind
see
of,
my age, I don't remember.
now we moved from the content to the form. What kind of form of instrument?
So the Framework Convention is a term of art that has been coined in the environmental field. Why? Because the level of obligation depended on science that kept moving. So you couldn't lock it in a treaty. You needed an institutional framework, conference of the parties and so on, that could develop the law, that could develop the level of obligation as the science became clearer. The FCTC was named a framework convention, transposing that concept to a totally different environment. But since then, any proposal on a treaty in the field of health must be a framework convention. So I would also, it may be a good idea, but we shouldn't jump into it critically. So do we need that kind of approach? For what and why? Because again, look at the FCTC. I think it gives some good lessons. I remember during the negotiation of the FCTC, people were dreaming about 8-10 protocols. Look at now, we have one protocol. It took 4 years four painful years to negotiate. It took 6 years to enter into force. After 9 years from the adoption, it has 63 parties. It's not bad, but it's a third of the number of parts of the FCTC. So it wasn't a proof of concept. So if we need it, for example, in something very science-based, like zoonotic risk, like One Health, I agree that it's a moving target. So you do need that approach. But for other parts of the convention, you may not need that approach. And so also, you need to go to look at the content. So the function should define the form.
One quick, and then
one quick, just, I mean, I said 6 months, but looking at time, just thinking about the tobacco convention, you can think that was a long time. At the same time, it was not that long time, and big success. No one is smoking here today.
Yeah.
So, I mean, it actually works.
Yeah.
Thank you. Jawoud, maybe I can give you the first question also from my iPad here, from the audience that is at home. Are low middle income countries included in the drafting process of the proposal of a pandemic treaty? How can we make sure that the needs and situations of low middle income countries are referred to?
Oh, thank you very much. This is extremely important question, and this is the strength on the WHO governing bodies under which this process is undergoing now, is that the whole 194 countries are involved in discussing the future of pandemic preparedness and response. The last assembly in May established member state working group to look to the pandemic preparedness and response. They are meeting and they are discussing with every single country in the world. The 194 are involved, are participating, giving their views. Of course, on your question about the content, we saw recently many publications, many non-papers who speak about potential content of a new treaty or new instrument. But I think the World Health Assembly mandated this group of this working group, which again include all member states, to give an advice to the special assembly that will be organized on 29 of November on the benefit of a treaty, and also in view to establish a negotiation body to discuss the content of the treaty. And the ownership of member states in this process is extremely important. If you are speaking about solidarity, if you are speaking about countries to support each other, if you are speaking about global mechanism, countries should own this process and should come together in very consensual way on not only the benefit, but also the element of a new treaty. And so far, what we are hearing from this discussion is there is no either or, but member states think that they need to move in parallel in three major issues: strengthening WHR to make its implementation and the compliance better, strengthening already existing mechanism, and discussing a new instrument that can cover issues who are not under the IHR under WHO constitution. About the timing, I think, it depends on the willingness of the countries. They can do it in 10 years or can do it in 6 months. WHO constitution was written and approved in 1948 in 6 months. And when you look to this constitution, how comprehensive is, I think if member state would, and if they want, they can do it very quickly, taking in consideration the problem that we are discussing.
Thank you very much. I will now take 1-2 questions from the iPad here, and then I ask you to maybe raise your hands. So next one is maybe for all of you. Will there be a pandemic treaty without the support of the US? How can we make sure that the US supports the proposal? So geopolitics. Gianluca, would you like to start?
Well, the US obviously is a very important player, but it shouldn't be the game stopper. Again, let's look close to home, the FCTC. The US was involved in the negotiations, but it made it very clear that it would be very unlikely that it joined the treaty, and it did not. But the FCTC was adopted, entered into force, and is proving its worth even without the US. So I think that I agree with Jawad that it's a good direction that countries abandon this either-or approach. And the dealing with the IHR, with WHO, and with the new instrument is a way also to keep the US engaged. But at the end of the story, we shouldn't be blackmailed by any country, so not even by the US. So I hope it will be a engaged country, a positive actor. But one of the risks, in my view, is that it may try to weaken as much as possible a treaty, or to obviously turn it very much to its advantage. I remember again in the FCTC, many things were weakened out to accommodate requests from the US because it was seen as an essential player. And at the end, it also asked for the possibility of making a reservation. And at that point, many countries, I remember the African countries said, no, that's it. We draw the line, and if you're out, you're out. So I hope we don't go in that direction, but we should prepare also for that kind of scenario.
Anders, would you also answer the question?
I mean, what I'm hearing from the US government is that they have, they share very much the interest and the priority, the content of what needs to be done. I don't see this a difference here in between many countries that are more sort of behind, saying also that we want a treaty or a convention. Then, of course, with the Congress, etc., they say that this is not likely to be possible for us. So it's more of a, I would say, practical aspect from some of the politicians there, a reality check. So I hope it will not be weakened because of them. Hopefully there will be a possibility for them to still be associated with it, to be an observer or something, but still to be part of the negotiations so that we get the content right. And there I'm quite optimistic.
Okay, maybe Simona, I can give you also another question, because there are some questions coming in on the World Trade Organization and TRIPS waiver, of course. So does Germany lose its credibility when its efforts to secure a pandemic treaty, when it isn't willing to negotiate the TRIPS waiver? And also another question going in the direction, the World Trade Organization members are not willing to agree on the TRIPS waiver within a year. Is the pandemic treaty process any different? Which I quite like.
Okay.
That was an easy question.
Yeah. Listen, I mean, I am also following the TRIPS discussion, unfortunately. I'll be very honest with you. It's dead end, this whole TRIPS thing. I don't think it would make any difference immediately, this patent waiver. And I think that's the big confusion between people. They think, okay, if we lift this patent now, we will help India, we will help this country, that country. India and South Africa that requested it. It is not true. If you look at one of these mRNA vaccines, it has more than 15 patents just for one of the processes. It is so complicated that nobody knows how to do it. Without the know-how, this is just a kind of a fairy tale that you would lift the patent and something will happen. In the long term, however, I think this is one of the solutions that should be explored. And in the EU, there is a discussion ongoing. It's not that Germany is against, that someone else is for. We are trying to build what is also called by the DG of the WTO, a third way by Ngozi, because that is the practical way, because it's, if you want to lift a patent, you have to pay the companies for their investment and their innovation. So it's also a money question, a financial one. It's not a nice moral thing, because if, and let's be honest, Pfizer, you know, we're in the country of Pfizer, they did 80% of their innovation investment by themselves. It wasn't with public money. So, and they gave us those vaccines. So if you want to take their thing, you have to pay for it. This is the kind of society we live in. So I wouldn't link the two. The TRIPS is not urgent, and member states know it's not urgent. Also, even the US, you've seen President Biden called for the waiver. US has not moved, has not even replied in the World Trade Organization on the EU proposal for a third way. So even for the Americans who change position, it's not urgent. And I would link that to what we were discussing just before. I don't think anyone is against the treaty. I just think people are a bit concerned what is most urgent. And I think this is normal in a time of crisis. That's why I say I have a different perspective. I'm a crisis manager, and my general daily job is to use the whip on our organization and to tell people actually everything is urgent. You have to do everything at the same time. And it's horrible. And it's a huge stress on all the structures. But I think it's a big mistake to try to prioritize one over the other. And as Joad says, discussions in Geneva are advancing and member states are coming to those conclusions. And we'll have to find a way to accommodate member states for their ratification processes. I'm sure US is not the only one, but this is in the future. I am, you know, we're working on it. I'm not that concerned that only one member state can block an entire treaty.
Thank you. Maybe we have time for two very quick questions here from the audience.
Wow, okay.
Maybe we start with Mark. Do we have a microphone?
Thank you. So I just wanted to ask about the risk of fragmentation. We have one of the huge benefits of IHR is the manner in which it becomes binding upon member states through its opt-out process. With the treaty, that is not the case. And you will inevitably end up in a situation where all member states of WHO will be a party to IHR. Some will be signatories to a pandemic treaty. Some will be signatories and ratified a pandemic treaty. And if we take the framework convention approach, some will be signatories and ratified some of the frameworks, some of the protocols, but not others. So this could actually cause further fragmentation of the international system and lead to a much more fragmented response in a future pandemic, rather than actually create a harmonized system and set of rules that everyone will follow. I wonder what you think of that future problem.
Thank you. Let's take another question behind you.
Thank you, Nicole DePaula. Just to complement that, given the political situation we are in, and how are we thinking that if we take the climate situation, we promised by 2020, 100 billion, right? We're a bit far from that. And 0.5 goes to health connected co-benefits, for example, to health. So my question is, could we be more concrete where this predictable finance would come from? And connecting to that, if this initial proponents are thinking about the synergies between health and environment, because if we're talking about collaboration and prevention, we would need to take this into account. So just how the initial thinkers are taking that. Thank you.
Thank you. So maybe we take one other question, and for the last round, you can decide and pick on what you want to answer. So one more.
Yeah, so thank you. My name is Niklas Kramer. I also work in the Federal Ministry of Health in the team of Björn and following the negotiations. So I'm actually, I see some positive signs going on, as Gianluca said. So we have in the working group, there is a certain consensus emerging of sort of 3 ways of reform. So doing IHR targeted amendments and also opening the discussion on the pandemic treaty. So towards the negotiation process and the discussion on more of a how to organize the negotiations, but if there is a opening of a mandate for a pandemic treaty. I have 2 questions. So one major point is from the German government position is how to improve the compliance and the review mechanism of the IHR. Here tomorrow we will also have a session on the periodic reviews, which is one idea. And also our minister, even this morning, he said the word sanctions. So I don't know about that one, but to you, Gianluca, looking at the legal question, would you address that more in the IHR itself, or would you use the new instrument ? To address these issues? And second, talking about the expectation management and the time frame. So there will be a huge challenge to manage these expectations, that we will have speedy results of at least certain parts of the treaty. So how would you organize the negotiation? How can we concentrate or maybe identify the parts we can agree faster on than some other parts? How can we also bring in smart legal ideas around these very tricky issues like equity, where we definitely have a lot of discussion. So thank you very much.
Thank you very much. So 3 questions for 5 minutes. And you just opened the box of Pandora of sanctions. And so I think we need to meet outside again for coffee and bring all of the ideas together. So maybe we start with Jawood, and you can pick what questions or what you want to reflect on.
Yeah, thank you very much. Quick comment. First, whatever we agreed to do, it should be established and agreed upon during peacetime. Things that we do while we are responding to COVID are never perfect. We cannot solve the problems of equity while we are responding because of many issues. And one of the example that exists in WHO is the pandemic influenza preparedness framework, where the member states agreed if a flu pandemic happened, 10% of the global production should be given to WHO to be distributed to the low-income countries in the beginning, not after the pandemic. This is one example that member states already agreed, and similar mechanisms for other pathogens could be discussed and agreed upon by member states.
Maybe one more.
Yeah, and just to say about the question about the treaty or framework under Article 19, although it's based on opt-in process, we heard in the beginning of the FCTC discussion that countries may not join. And as of today, we have more than 180 countries, state party of the FCTC. I think if there is agreement among the member states in the negotiation process, they need the treaty and the content of the treaty. I think the process of ratification will be easier.
Thank you very much, and sorry for cutting you off. Maybe we go in this direction, Gianluca.
Yeah, thank you. I'll take the question on fragmentation, and I'm sorry we don't have time to address the question of compliance and sanctions, which I think is central. But on fragmentation, fragmentation to a certain extent is inevitable. International law is very fragmented, and it's a particular challenge for health because health is scattered everywhere, and so it is a main victim of fragmentation. That's why if we go towards a treaty, I go back to the picking strategically its content to minimize the risk of what you were talking about, but also so the world is not stopping waiting for a pandemic treaty, and other communities are moving. And I mentioned one, the one on biodiversity, because the meeting of the parties or the Nagoya Protocol is discussing things that have been discussed in WHO. For example, whether genetic sequences will fall under the scope of the treaty, whether how to define what they call a specialized instrument that will carve out from the Nagoya Protocol. So there are also other moving parts that can happen, particularly if the negotiations in Geneva take too long. It may maybe obviate some of the fragmentation risks or not, but it's a risk that we have to accept while being strategic on how to minimize it, to reduce it.
Simona.
I think, well, on fragmentation, I fully agree with Gianluca. I think part of the compensating factor we hope will be the national implementation, so the legislation. But it's a fact. I would then take the question on the climate and the geopolitics, on the predictable finance, the synergies. One thing, like Gianluca tried to explain, indeed, we would like to have synergies through the One Health, which is what is missing in the IHR now. But also look, at the geopolitics. You say it didn't work, we didn't put that much money, but let's not forget, we've got Russia, China, and the US. US is back. They went out of the Paris Agreement, they came back. The EU, all the big regions have committed, whether it's 2050 or 2060, it doesn't matter, but to the zero. Let's not take this as no success. On the contrary, we had a huge success. And now the entire industry is getting geared up to invest in this. So I would say if we get to that level of commitment, which for me should be obvious for our health, just as for the animal health, I'll be very happy.
Thank you very much. Anders.
Oh, thank you. A couple of quick comments. Fragmentation. I think the whole idea with the convention to be more comprehensive. So it's not just about the system, it's about the content. As I said, IHR is quite limited. So there's an opportunity with the conventions to be more comprehensive. That is avoiding fragmentation. On financing, I think one needs to make a distinction here. Financing for WHO, financing associated with a treaty, that can never be big money. What the panel recommended was big money. Not aid, not ODA, but based on a formula according to ability to pay. Basically an investment in global health security and stability, potentially hosted by IMF or the World Bank. So that is something else that we need to have a separate discussion around. The universal periodic peer review, I think one could learn from the climate architecture here again, how the climate panel is working with national reports. And also, of course, from the human rights system. Finally, in terms of crisis and being able to deal with the crisis, but on the same time dealing with the future, I was the head of the WHO country office in Sierra Leone during the Ebola outbreak, one of the poorest countries in the world. We did both. We dealt with the outbreak, the crisis, at the same time as we invested in the system for the future. Sierra Leone's government actually was able to do two things at the same time. That's not the situation with many countries where we are right now.
Thank you very much. So we just started a new conversation about resilient health systems before also the next coffee break. So I won't wrap up because we don't have time for that. So thank you very much. We will have a deep dive tomorrow in the Universal Periodic Reviews and Accountability, same time, same room. There is an evaluation now online. This is the first time we are doing the policy track. So please give us one more minute. And I just leave with saying thank you to the panelists, thanking to the audience at home for sending your questions. We will forward them to the panelists. They are not, of course, I would just wanted to say thank you and now give over to Björn Kümmel for the closing.
Exactly. The host has the pleasure of the last final words, which you already more or less started. So first of all, I'd also like to thank on behalf of the host, all the participants, so Simona, Joad, Anders, Gianluca, but also the moderator for this interactive debate. There's been, to my sense, too much agreement, unfortunately, and not enough dispute, but we'll work on that, maybe potentially inviting one or two geopolitical powers to this debate next time and putting them into the hot seat there. I think I'd also like to thank you, the audience, for the well, for participating in the online voting, and obviously the questions. It became clear that I think many more questions could have been brought up, and so apparently the pandemic treaty is something that is hitting the nerve. I think it's fair to say that the world is not waiting for the consensus on the pandemic treaty. If there's one thing, and I'm sure there's also agreement on that in between the speakers and myself, is this is one of the most interesting moments in global health, because global health architecture will be reshaped in the next months or year, and be it in a multilateral setting like the pandemic treaty or not, decided by not 194 member states. We'll see, but it will be. It will completely look different, I'm sure, in the next year. So how will we take this forward? I think this was very, very valuable for us, not only for myself, but as you saw already, my colleagues, the IHR colleagues, experts from the ministry are here. Also the foreign affairs colleagues are here. And that session really helped us to shaping our position further, the ongoing debates in Geneva, and then obviously the turning point, potentially, the special session of the Assembly end of November, start of December. Anders, I'm sure, although we might be agreeing this is simple, but it will not be simple in Geneva because the diplomats will come in. One thing is clear, and I'd like to take the words of Gianluca, it will be painful. But diplomats and health colleagues, they love these painful negotiation exercises. So yes, and we have lots of medical doctors there, so it's going to be an interesting journey. The final thing I'd like to say is the pandemic treaty will also come up outside the World Health Summit. There is a session hosted by NGOs about the merit and also inclusivity of the process today, I think at 4 o'clock, and I'm sure more information will be gained in the margins. Plus, as Michael Voss was already alluding to, there are 2 sessions tomorrow. One already at 9 o'clock, which is the Global Preparedness Monitoring Report, which is clearly linked to the pandemic treaty exercise. And then a second policy track session on the UPR system, what exactly also in this room, where, at least from my point of view, which could be an additional game changer in the IHR work. So with that, I'd like to close this session. And again, thanks to all of you and obviously to the panel and the moderator. Thanks a lot.